Mental Health Disorders Lecture. The objectives for this lecture are to identify the etiology, symptoms, diagnosis, and treatment of common mental health disorders. Intellectual disability is the first disorder we will talk about. This is a condition of decreased intelligence leading to a decrease in the ability to learn, socialize, and mature. The etiology is often unknown, but in some cases is genetic or acquired. Symptoms include difficulty learning and grasping concepts. The diagnosis is generally IQ testing, and there is really no treatment, but in severe cases, patients will be placed in assisted living complexes. Attention Deficit Hyperactivity Disorder, or ADHD, we often call this, is the inability to concentrate, hyperactivity, and impulsiveness. The etiology is unknown. The symptoms are forgetfulness, not appearing to listen, excessive activity and energy, inability to complete detailed work, inability to organize, and disruptive. Diagnosis is really by observation, and treatment is generally by medications such as amphetamines, which include Ritalin and Adderall. Eating disorders. There are two different eating disorders. There's anorexia nervosa, which is self-imposed starvation, and bulimia, which is episodes of binging and purging. The etiology is unknown, but societal expectations may play a part. Symptoms are decreased energy, growth retardation, cardiac disturbances, and personality changes. Diagnosis is physical exam and diet history and reports from other family members, as oftentimes patients do not like to admit or tell physicians about their problem. Treatment is counseling, family support, nutritional consultation, antidepressant medications might be needed if this is the cause of the eating disorder. Alcoholism is a physical and mental dependence on alcohol intake. Etiology is unknown. Symptoms are intoxication, blood levels above 0.1%, hangover, nausea, fatigue, sweating, and thirst. Withdrawal symptoms are hallucinations, tremors, seizures, delirium, agitation, and memory loss. And treatment is generally rehabilitation. Substance abuse, we have several different mechanisms that fall under the substance abuse category. Some of the most prominent, especially today, are heroin, methamphetamines, and cocaine, and also marijuana. We also have caffeine and nicotine that also falls under the substance abuse, ecstasy, LSD, PCP, inhalants, and anabolic steroids. Some other substances that are oftentimes abused are bath salts and cough medicines. Psychosis is a term describing conditions characterized by a disintegration of one's personality and the loss of contact with reality. Schizophrenia is a brain disorder in which people interpret reality abnormally. The etiology is various theories exist, including genetics, overproduction of dopamine, or individuals that are deprived of meaningful relationships. Some symptoms of schizophrenia are loss of touch with reality and act on imagined or fantasized reality, delusions, hallucinations, flat or lack of speech, muscular rigidity, and unresponsiveness. Diagnosis is a verbal screening, and treatment is usually with antipsychotic medications and anti-tremor medications, and also therapy. Delusional disorder includes grandiose, jealous, persecutory, and somatic. The etiology is unknown, although genetic and environmental factors may be linked. Symptoms include irritable, anger, low mood, and hallucinations of sights, hearing, or things that aren't really there. Diagnosis is observational, and the treatment is antipsychotic medications. Depression is a prolonged feeling of extreme sadness or happiness, despair, and discouragement. Etiology can be genetic due to a lack of neurotransmitters such as dopamine. Situations, age, gender, weight, and social isolation. Some symptoms are feeling rejected, helpless, and worthlessness. Is indecisive and disinterested in surroundings. Does not enjoy pleasurable events. Low energy and always fatigued. Unable to sleep or sleeps excessively. Might cry easily or have suicidal thoughts. Diagnosis is blood tests, CT scans, and psych questionnaires. Treatment is psychotherapy and generally antidepressant medications. Seasonal affective disorder is usually also called winter depression. The etiology is the increase in the melatonin hormone, which is released by the pineal gland during dark hours. Symptoms include chronic fatigue, excessive sleep, and excessive eating with weight gain. Diagnosis: people having bouts of depression 2 consecutive years during the same season. And treatment is antidepressants, generally SSRIs, and exposure to UV light. Bipolar is a type of depression with bouts of severe depression and mania. The etiology is unknown. Current theories say genetics and biochemical deficiencies are the cause. Symptoms are mania, which is generally an extreme euphoria with increased energy, restlessness, and rapid thoughts. And sometimes irritability, denial, anything is wrong, or unrealistic beliefs, which then bipolar is usually a swing between the mania and the depression, and depression we just talked about. Diagnosis is history of individual and mood disorder questionnaire, and then the treatment is psychotherapy, and oftentimes we put these patients on lithium type medications. Anxiety is a response to stress, but some responses become chronic. There are a couple of different types of anxiety. There is generalized, which is excessive worry, not related to a specific event. Panic, which is a state of extreme fear. Phobia is an intense, irrational fear of an object, situation, or thing. Obsessive compulsive is the repetitive of a thought or emotion and the inability to stop the act of doing it. Post-traumatic stress disorder is response to a psychological distressing event in the individual that the individual did not have control over. The etiology is genetics. Severe stress, biochemical imbalances, and hyperthyroidism can oftentimes lead to anxiety. Symptoms include, it really depends on the type of anxiety as far as what the symptoms are. The diagnosis, history of symptoms, and then the treatment sometimes could be hypnosis, stress reduction, relaxation therapy, physical exercise, and anti-anxiety medications also can help. Somatoform disorders, a disorder characterized by physical symptoms that lead to one to believe in a physical disease, but no organic or psychological cause can be found. So there are a couple different types of somatoform disorders. Conversation disorder, which is a dramatic physical symptom such as paralysis of a limb, blindness, or numbness and deafness. Hypochondriac is an abnormal anxiety about one's body and health. Have a good understanding of medical conditions, are very watchful of any types of symptoms. Oftentimes, new medical students become hypochondriacs as they learn about different diseases and symptoms. Pain disorders, pain that does not have a psychological cause. So sometimes patients who have been in pain at one time and then it eventually goes away, they become addicted to medications. And oftentimes they convince themselves that they do have pain, but there's no physiological cause to that anymore, and they actually don't have pain. This is called a disorder. Malingering, which is a fictional display of symptoms to gain financial or personal reward. You see a lot of times people doing fundraisers to say that they have cancer when they really don't. Munchausen syndrome, the affected individual stimulates illness for no apparent reason than to receive treatment, often going to extremes to have positive tests. Personality disorders. Individuals with personality disorders have traits or factors that make them feel and behave in an unacceptable or unsocial way. So there are 5 different types of personality disorders. Is paranoia, where traits of jealousy, suspicion, envy, and hypersensitivity, extreme mistrust, and suspect their motives and intents as deliberately harmful to them. Schizoid, which is a loner, lacks warm and tender feelings. Antisocial, which is a behavior such as fighting, stealing, runaway, cruelty, often selfish, irritable, and aggressive. Narcissistic, which is extreme sense of self-importance and self-love. And histrionic, which is an overly dramatic with expressions of emotion.